Hello and welcome to Hair Loss Solutions with Your Hair Network. How you doing? I'm Vince Bailey, and you know, hair loss is an issue that is plaguing millions and millions across the country and around the world. It's affected me as well. There are solutions, and today is an exciting day for you because you're going to get an opportunity to chat in your questions. We have live the founder and director of Anderson Center for Hair, Dr. Ken Anderson, joining us. He is uniquely qualified in this world because he is a double certified facial plastic surgeon who decided to make his practice solely all about hair loss and hair restoration. He did that in 2003, and he is with us here now. And we'd like to welcome Dr. Ken Anderson. Tell us a little bit about yourself. Introduce yourself to our audience.
Well, thanks, Vince. My physician career started out as an ear, nose, and throat surgeon. I also took a board certificate in facial plastic surgery, as I believe you mentioned, but I really found a passion and my calling in medicine when I discovered the field of hair restoration surgery in 2003. And really, it was a field that was very underserved at the time, which is sort of a changing thing in 2018, but certainly in 2003 it was a much different field, and I saw a real opportunity to not only help people with their hair loss using my artistic background and background as a medical illustrator. Hair loss and hair transplant surgery requires a lot of artistic acumen, and when I'm doing the surgeries, it really feels like I'm drawing. So it really is an ultimate combination of both art and medicine and science, and plus it makes people feel great. You know, I really enjoy the surgery. The other thing that I noticed about the field of hair restoration surgery is there was a large opportunity for education. There are not a lot of, if any, fellowship programs in the country. I think there are a handful out there. I believe they're run by various institutions. What brought me to Atlanta was the fact that Emory University was putting together a multi-specialty center, and I was hired as the chief of hair restoration surgery for Emory in 2008, about 10 years ago. So what I have founded is an academy, the American Academy of Hair Restoration Surgery, and together with Your Hair Network, we're going to be offering courses not only to physicians about how to do the surgery, but the technicians that are also involved in the surgery, but also to hairstylists and boutique owners who want to be a little more educated on what to say to their patients with various types of hair loss, because you know, hair loss is very distressing. Very distressing. Some people minimize it. I've had patients, you know, get a bit emotional in my office and say their mom said, "Don't worry about it, just shave your head," or "You're fine," or a little bit of placation. Well, the psychology studies show, and this is so interesting, that there's literally zero correlation between the actual clinical degree of hair loss and how that person or patient feels about that hair loss. And what that means is a tiny amount. A tiny amount of hair loss can be devastating to some people, prevent them from taking jobs or even going out on a date perhaps. But you have other people on the opposite end of the spectrum. You know, I've got some guys who come in, they're my dad's age that I play golf with sometimes, and they're bald. And they'll tell me, "Hey doc, I'm starting to lose it up top," and we kind of joke. I'm like, "No sir, it's gone." And so you have them and everything in between. But when you practice hair transplant surgery and hair loss treatment full time, you see this broad spectrum. So my staff and I have a very deep and caring, deep understanding for the needs of our hair loss patients, because that's the only type of patient we see at the Anderson Center for Hair.
Wow, Doc. Well, I tell you, so many people, this affects so many. Could you tell us, how does hair loss happen? How does it take place?
Yes, hair loss in men and women, the typical form of it, the male pattern baldness and the female pattern baldness, these are genetic in nature. Persons with hair loss have inherited that from both mom and dad. Kind of in a combination of how the person may have inherited the shape of their nose. Through inheriting a sensitivity to the various hormones that can cause hair loss. As patients get older, certainly they notice hair loss. That can manifest as early as 15 or 16 years of age for men, and really can manifest at any time through adulthood. But with females, it tends to peak in incidence around menopause, around the late 40s, early 50s, right in there. But it's a problem that a majority, frankly, of men suffer with, and about 40% of women at some point will have clinically significant hair loss during their lives. So it's a much bigger problem than most people realize, and we're here for those patients.
I just want to remind our audience that you can chat your questions in, just type them in, and we'll get right back with an answer to you. Doctor, I have to ask, are there solutions? Can you tell us some solutions there are to prevent hair loss?
Well, yes. In fact, there's really never been a better time to have hair loss if you look at it from the perspective of all the new technologies and biologically active treatments that are available for hair loss. I mean, for men, we've got a drug called finasteride, and finasteride actually lowers the level of the hormone that is causing hair loss. It's definitely not for women, though. For women, we've got other things like laser therapy, which actually can be used by both men and women. It's just a little laser helmet you put on your head 6 minutes a day, and that can help to stop hair loss, and in some cases can actually affect regrowth. We've also got a procedure called platelet-rich plasma, or PRP procedures. And what this does is take advantage of the growth factors contained in the patient's own blood. We will draw off a tiny amount, 22 cc's of blood, not very much at all, and then we spin that down and separate out the cells that are called platelets. And the platelets have all the platelets are the cells in your body that orchestrate or quarterback the human body's tissue rejuvenation and healing systems. So what we do is we draw a tiny bit of blood, separate out those special cells with all their growth factors, and then in a painless fashion reintroduce them into the scalp, into the areas of hair loss. And this is a biologically active therapy that is thought to stimulate your stem cells, or a patient's stem cells, so those hair follicles can make bigger and better hairs. There are also other things like shampoos, Viviscal vitamins. There's topical therapies like Revivagen scalp therapy. There's also topical finasteride with minoxidil. There's also Rogaine. You know, there are many, many different treatments actually. I once heard there were over 200,000 products out there marketed for hair loss. Do they all work? No, they don't. But a few of them actually do work and have actual science papers behind them, proof, research studies, patients, success stories, and those are the treatments that obviously I would recommend, and those are the treatments that we offer.
Well, Doc, just like a lot of folks, I'm looking and it's slowly thinning. But I know, or could you tell us, are there ways that we can change that and grow our hair back?
Absolutely. That really can be done non-surgically or surgically. Now, with non-surgical methods, those would include platelet-rich plasma, that would include laser therapy, that would include things like topical finasteride, a few of the more major therapies. They have the primary effect of stopping hair loss in the majority of patients, but a smaller subsegment of patients will realize some hair growth. Some get a bunch, some get a minimal amount, but most will see their hair loss progression dramatically slow down. Some will see a little bit of regrowth with no surgery whatsoever. However, for patients who are older than 40, because typically the non-surgical regrowth happens in patients under 40, for patients over 40, a surgical hair restoration is available. Now, it's not what a lot of people remember it as, the pluggy look, the doll's hair appearance, things you could see across the restaurant, or you might see on the airplane, like, that ain't right. Well, you probably would never notice a modern hair transplant today, because it's literally a one follicle at a time transplant. The hairs come out of the head in individual follicles, And we harvest those follicles from the permanent areas of the scalp and implant them back into the areas of need in the same individual grouping. So it literally cannot look pluggy. It cannot look like doll's hair. And so really the best hair restoration surgery results fly right under the radar. Man or woman walks in the door, you look at him or her and it looks like the hair has always been there and not like someone put it back. And so it's really not obvious anymore who's had a hair transplant. And so unfortunately, the bad ones are still remembered because they're so obvious, but you know, we can really do an amazing amount of natural, permanent work. And this is where the artistry comes in. I like to do the frontal hairlines. I mean, that's the part that's really like drawing. You know, as you look at someone and there's a transition from the hairless forehead to the hair-bearing scalp, what's in between there? That's the hairline. And that's how well that is done separates the men from the boys in this industry. And you know, I think we do a great job of that, and I think our pictures bear that out. What's special about this practice and what I'm really excited to talk about is something called robotic hair transplant surgery. We are proud to be the first in Georgia with the ARTAS, A-R-T-A-S, the ARTAS Hair Restoration Surgery System. It's a robotic system. We got our first in 2013. I now have 2 robots and I'm a national trainer on the device. Well, what does it do? It allows us to obtain hairs from the back and sides of the head or the permanent zone and prepare them for transplantation without using any scalpels. There's no stitches and there's no linear scarring across the back and sides of the head. That scarring has been what has kept many men and women from coming and having or even talking to a hair transplant surgeon because you can look online and see the horror stories about the large scars and that are hard to hide with your own hair. Well, it's all changed now. I've got a robot in the back here that quite literally and physically looks at your hairs up super close and under my guidance extracts one follicle at a time, leaving no linear scarring, allowing for much shorter hairstyles than were ever possible with hair transplant surgery results in the past. So all that to say that if you've lost hair and you know the non-surgical methods are not bringing it back, you know, you want to meet with a hair restoration surgery specialist who can go over your options, because every patient is different. Every patient is different, and that's what I think is lost on a lot of people. They think that, you know, hair is hair, and you know, if it's really not that simple. So I'd suggest if you're having hair loss and are considering, you know, just putting it back, then meet with a doctor who specializes in it, because the reality is, it's your real growing hair. After it's transplanted, you got to cut it, you got to care for it, you got to style it, you got to shower it. It's your own growing hair, and you know, I've never seen happier patients. Patients are blown away by how painless it is, how natural it looks, and how little scarring is present in the donor area. So it really has come. I mean, so even since I started in 2003. We really didn't have the type of surgery that just does it without any linear scarring. And so it's not really you know that old saying, it's not your father's Oldsmobile. I like to joke with some of my staff that, you know, that's not so applicable with hair restoration, because really it's not even your older brother's hair restoration anymore. You know, it's really every year it's making great strides, and it's a great time to be in the field. And as mentioned, never a better time to have hair loss.
Well, Doc, this is very, very encouraging. Now that we're all excited, how does one engage with you and engage with Anderson Center for Hair?
Well, the easiest way would be to visit our website. It's AtlantaHairSurgeon.com. AtlantaHairSurgeon.com. You could give us a call at 404-256-HAIR, which is 404-256-4247. Those are the 2 main ways. You could go to realself.com and look up Dr. Ken Anderson if you want to see where we keep our reviews on a third-party site. We got almost 250 of them. And mention when you give us a call or when you see us here in person, mention that you saw us on Your Hair Network.
Well, Dr. Ken Anderson, we really appreciate you sharing all of your knowledge, and we look forward to working with you here at Your Hair Network. And I know your phone's going to be ringing off the hook because you do have those solutions for hair. Thanks so much again, Doc. And ladies and gentlemen, well, you heard it from the doctor himself, the expert, Dr. Ken Anderson. For more information, of course, you can contact them. And of course, you can always find information at your network. It's Your Hair Network. Thanks so much for watching.